there's been talk for years about whether bioidentical hormones are safe and effective in treating menopause.
There's some new research out about that, and today Dr. Steve Lasater from Physioage is here to tell us about some great new information out there. And Dr. Lasater, you're such an expert in this field. I'd like to just start out by asking you to explain to our viewers what we mean by the bioidentical hormone specifically and how it helps treat women going through menopause.
Well, Terry, bioidentical hormones are those that, as they are administered or taken by the patient, are identical to the natural hormones that that person had when they were younger. They may not be totally derived from a natural source, but they are chemically changed so that by the time the person takes them, they are the very same hormones that they used to have, as opposed to synthetic hormones, which by the time they're taken, in the form that they're taken, are quite a bit different from the hormones that the person's body produced when they were younger. And presumably, and I think that this makes full sense, we're replacing the hormones with the same kind of hormones that their body had and responded to during most of their reproductive years.
Okay. We know that hormone replacement can be pretty controversial. Those people on both sides. You actually brought in some studies that really talk about some of the latest things that are being said about this subject.
Yes. There's a major academic medical journal called Climacteric, which earlier this year had a special issue about some of the advantages of transdermal estradiol and micronized progesterone. And the academic world is finally starting to admit that perhaps there is some value in these form of hormones. And that they point out, very interestingly, that these type of hormones, as opposed to the synthetic hormones that have been traditionally prescribed, that the bioidentical ones reduce the risk of heart disease and reduce the risk of diabetes, which is, I think, very important in today's society with an explosion in the incidence of diabetes. Not to mention the fact, they didn't mention it, but it's true, that it helps the person, the man or woman, particularly the women we're talking about here, feel better, helps their skin be younger, helps them have more energy, improves their libido, just basically makes them feel much younger, and besides reducing the risk of major diseases.
So why the controversy?
Well, that's a very good question, Terry. There was a major study that was published about 10 years ago, the Women's Health Initiative, which looked at the effect of synthetic hormones, primarily on older women, and they found some negative effects, although they found a lot of positive ones too, but the negative ones tended to get more press. But they were looking, I believe, at the wrong hormones, the synthetic ones, not the bioidentical ones. And they were looking at a group of women that were already quite old and had been in menopause for upwards of 10 years. That engendered a lot of discussion, and there was then sort of a carryover effect in that even though this was looking at particular synthetic hormones, the implication was that any hormones might therefore be bad, which was not the case at all. They looked at conjugated equine estrogen, the hormone, the estrogen mixture from horses, and medroxyprogesterone acetate, which is synthetic, and they did not look at natural estradiol or bioidentical estradiol or at progesterone. And those are quite a bit different in many of their effects.
So Dr. Lasater, if somebody was interested in coming to see you, learning more and possibly engaging in this type of treatment, what does it involve?
First, we talk to them, get a medical history, and then do extensive blood tests to look at their hormone levels. But in my practice, Physioage, we look beyond that because it's not enough to just make sure the person's hormone levels are adequate. If, for instance, their cholesterol and triglyceride picture is such that they are at significant risk for heart disease. We look at that. We look at a number of what we call biomarkers, physiological measurable parameters such as central blood pressure, skin age, neurologic age, cognitive age, lung age, and then extensive blood testing of trace elements besides the hormone levels, and try to come up with an overall plan that helps the person achieve optimal health. A lot of that, of course, is based on replacement of hormones if they need it, and most do, but it also is looking at lifestyle, weight, exercise, control of cholesterol, and particularly not just the cholesterol numbers, but the number of the particles that carry the cholesterol, which is really the most critical factor for cardiovascular risk assessment.
Are we talking about an age when a woman should make that call, or how would a woman know? Because it seems like there's a variability in the age to which maybe we all begin that process of starting menopause.
Well, exactly, Terry. I mean, I think the average age of menopause is in the early 50s, but the symptoms of menopause, the perimenopause, or the time around menopause, the symptoms of that can start as long as 10 years before the actual menopause.
So early 40s even?
Early 40s, even mid-30s in some women.
Okay.
Yeah,
Yes.
we've heard about that. And so this sounds very thorough, and it's very interesting. You are actually offering a special to 8 West viewers if they would want to come in and learn more and start some of those steps.
Well, we are. I feel a burden for the people in West Michigan, and I know that there are thousands of people out there that are not being treated adequately in this area. So if patients call up, or potential patients call up through the rest of this week, Physioage Grand Rapids is offering $150 off of our standard price for the initial consultation at our office.
Well, thank you so much for being here with us today. It's a complicated topic. I think we really have just scratched the surface. You also have a great website where women can, and men, but primarily women, can go for more information as well.
Well, thank you very much.
Yeah.
I enjoyed being here.
We'll be right back.